And it's going. Perfect. Thank you, Jackie. Jackie, my lovely assistant. She's helped me prepare for this meeting today. Welcome, everybody. Dr. Lowe here, ready to talk about sleep apnea. And of course, we have to give a disclaimer. Hope you read this. Always together we achieve more. So, what is sleep apnea? Welcome, everybody. Again, like I said, we're here to discuss sleep apnea and how to help you be healthier and feel better. Obviously, there's a lot of discussions going on about sleep, whether it's important or not. We're going to get to that. What happens when you sleep, why it's important, and also what happens if you don't get enough sleep. So that's important to discuss. Today is going to be a real fast and furious drive right through this so you guys can know what to do to help protect yourself, because who wouldn't want to help be healthier and well? That's our vision in Lifetime Dental Care here in Hays, Kansas, is to have Northwest Kansas be the healthiest region in North America by the year 2020. We got a pretty good jump on that. We're taking great care of our patients. We are taking care of all of Western Kansas, all the way up to Nebraska. We've got patients in Nebraska, Colorado, none really in Oklahoma. They find some other dentist down that area. But here we go. First question, did you get enough sleep last night? Did you? Do you know how important it is? Hope you do. I've got notes here so that'll help me out. What if you didn't get enough sleep? What are you going to feel like? Probably going to be groggy, cranky, reaching for the Java, trying to stay awake, trying to keep yourself motivated. My second question, do you know anybody that suffers from a sleep disorder that keeps them from getting enough sleep? What's a sleep disorder? That'd be sleep apnea. There's also snoring and not getting enough rest just because you're not getting enough air to go through your airway and keep you into deep sleep, like we're going to talk about. So what are the risk factors for a sleep disordered breathing situation? You can probably figure them out, but Harvard Institute, Harvard Medical School identifies the biggest sleep apnea risk factors as postmenopausal women. They're more likely to have sleep apnea. Obesity, number one. If you have a bigger, thick neck, you see some of them big neck guys with the stocking look like this. They can't get enough there. All that weight, all that constriction is narrowing their airway and affecting their sleep. And about 2/3 of all people who are obese also have sleep apnea. That's a known fact that's been studied. So number one is to try to lose weight. But hey, what if I'm already apneic and I can't get good sleep? How active am I going to be the next day? Am I going to really want to go out and hit the treadmill and try to lose a bunch of weight? No. What's my only thought? I got to survive today so I can try to get better sleep tonight. Males are more likely to suffer sleep apnea than females. If you already have a family history of sleep apnea in your family or sleep disordered breathing, you're likely to have it. Alcohol consumption before bed. Oh no. So if you have a couple beers or a glass of wine or something, you're going to be more adept to be apneic, and because it relaxes too much of the airway muscles that hold it open, so you constrict. And if you have slept next to anybody that has had too much to drink, bingo, you know what I'm talking about. That airway gets constricted and they make a lot of noise to keep that air flowing. Smaller jaw, so if you're born with a smaller jaw or smaller airway, you're going to have more chance of being apneic. Larger tonsils, obviously they'll occlude the airway and not let the air go through. And hypothyroidism, so if your thyroid's not working properly, low levels of thyroid, you're going to be more susceptible to it too. Half the people that have sleep apnea also have high blood pressure. I don't think that's coincidental. I know a lot of people who have high blood pressure and they don't fit the mold. They're young, they're healthy, on and on and on. They don't fit the mold, and boom, they have apnea. And I think that sleep apnea is the chicken that comes before the egg in this situation. You're also at an increased risk when you have sleep apnea to being diabetic, having stroke, and heart attacks. So obviously sleep's important. So are you ready to get some facts? Because sleep does matter a lot. Whether people want to admit it or not, I know sleep's not just for a luxury. Some people think, well, I don't get to sleep because I work hard and I play hard, and so I don't get to sleep very much. Well, you're really messing with your body, as we're going to figure out. So I didn't just dream up this stuff. This comes from a lot of research and a lot of sources. Our sources are ones you may not have ever heard of. The National Institute of Health. Yeah. Our government pays a whole department to take care of our people and show them what's working for their bodies and what isn't. Mayo Clinic, you ever heard of that one? Yep, there are sources too. They did a sleep risk factors, and we're going to go through some of those. And what was the other one I wanted to talk about? Well, just a lot of Mayo Clinic stuff. I just like stuff from the Mayo Clinic and the National Institutes of Health. People don't argue with those types of facts when they see them. So here we go. We got our sources. I've done my homework. Believe me, I'm not making this stuff up. But sleep, why does it matter? Again, if you're back in the 60s, sleep was considered, like I said, a luxury, and you were considered lazy if you needed lots of sleep. I've had buddies and people, I don't need a lot of sleep. I sleep 2 hours and I'm ready to go again. And if I'm partying, I can go all night long and I can go to work the next day. Well, when you're young, I guess you probably can, but as your body gives up on that and you get older and in your late 20s, you can't do that anymore. So now you realize how much you miss the sleep that you weren't getting. Now you're going to wish you had it. So have you ever watched a baby sleeping? You know, they're pretty peaceful, but man, they're breathing. We're instinctively known to sleep, that it's fundamental, because if you ever seen a baby that didn't get enough sleep, they're up, they're grouchy, they're rolling around, they're fussy. And why should we think that adults are any different, really, or teenagers or adolescents? So today, the World Health Organization, that's the one I wanted to cite, the World Health Organization and the National Institute of Health and Harvard Medical School all agree on one thing. They want to promote sleep as absolutely, positively fundamental to good health and longevity. And not just any sleep, but quality sleep. Many people have sleep disorders that don't even know it. Have you ever woken up from a long night's sleep and still felt tired? That's a sign of a sleep disordered problem. We all intuitively understand the impact that sleep has on our mood, but I don't think we really understand the consequences it has on our overall health and longevity. That's what I want to dive into. So that's next. Sleep and your health. What is sleep apnea? Apnea, sleep obviously means sleep, but apnea, some people don't know what that even means. Before anything, the letter A means not, means no. And apnea, or pnea, P-N-E-A, that means breathe. So apnea means no breath, not rocket science. So that's the definition. And what is sleep apnea? That's when you literally are suffocating multiple times per hour, be it 5-10 seconds to over a minute and a half. I've seen it. It registers. We measure it, and we'll teach you how to do that. So what if you wonder if somebody has sleep apnea? Well, they're going to snort, wake themselves up, try to that's the airway waking them, lack of oxygen in the brain, suffocation makes you become wide awake. And then you wake up, you snort, you roll over, and you try again. Your brain is not getting enough oxygen. So treating sleep apnea can lead to a reduction in headaches in the morning, improved mood, obviously, energy, wakefulness, memory, and cognition. Those are the ones you know. Here's the ones you might not know: the increased risk of stroke and heart attack and dementia. Those are the ones we're going to talk more about today. The Harvard Women's Health Watch, it indicates that these following health issues are associated with sleep apnea. Weight gain. Oh no, there it is again. If you're not sleeping enough, you're not going to get enough energy to get up in the morning to go do exercise, and you're going to gain some weight, and you're not going to feel like eating. I'll get to that too. It causes high blood pressure, decrease in the immune system's power. And again, the Harvard Women's Health Watch is worried about our life out here in Western Kansas, and we're going to have stroke, heart disease, diabetes, and chronic acid reflux from being apneic. So men have to worry about erectile dysfunction, but if severe enough, untreated sleep apnea even increases your risk of death. How do I know? I lost my cousin here, true story, 2 months ago. I got a call that my cousin Jimmy had a massive stroke, and he was 55 years old, and they rushed him to Colorado. He lives over in Ray, Colorado. They rushed him to Denver, and they got him there. Yep, I'm sorry, he's had a massive stroke, can't feel the right side, can't speak, can't walk, can't do anything. We're going to try to figure out what happened and what we can do next. And guess what? The very first thing they tested him for that night. This is truth. You're right. Sleep apnea. Guess how he scored? Here's the scale. Here's Jimmy. He's up here. What does that mean? He had no other comorbidities, they call no other risk factors for a heart attack or a stroke at the age of 55. He had his blood pressure was high, but Again, I'm linking that directly attributable to his sleep apnea. But he asked him, "Oh, I sleep great," and his wife said, "Jim, you stop breathing in your sleep. I wake you up, I push you, I kick you. You should have sore rib syndrome." And he never heeded the advice to get a sleep test done to find out how he sleeps. And he had his second stroke. Once they returned him home, they said, "There's nothing more we can do. Just take him home and try to figure out how to live with him, half paralyzed for the rest of his life." And he had a second massive heart attack or stroke, and he died. So I lost my own cousin, age 55, to massive stroke. And why? You guessed it. He had apnea, and over all those years, all that stress on his cardiovascular system of suffocation and suffocation and suffocation, a million times. Now he's dead. So that's why we're here. I want to make sure that Western Kansas is healthy and well, and that anybody reaching out and watching this can be healthy and well. So what do you think? Is lack of sleep impacting your life? Probably. Does it contribute to fatigue? Absolutely. Does it impact someone you love? Most likely. So let's look at some more hard science and figure out what's going on here. National Health Institute, this is the big one, addresses sleep deprivation. Sleep problems take a great toll on all ages, they found out, and both the younger and the older, in fact 70% of high school adolescents are sleep deprived, which increases the risk of suicide, mood problems, delinquency, and millions of U.S. adults have sleep apnea. Up to 80% don't even know it. This is coming right from the National Institute of Health. And recent research has also shown that poor sleep may cause cancer cells to grow twice as fast in lab rats. That's how serious this is getting. And sleeping too little might lead to an increased risk for Alzheimer's disease. So sleep also affects how your body reacts to insulin. And for lack of getting into how diabetes works, you're at higher risk for diabetes if you've got sleep apnea. Here's a quote. This is from the director Francis S. Collins, MD, PhD. "Feeling tired is only one consequence of getting poor quality sleep. The National Institute of Health funded research has helped illuminate a wide array of health challenges stemming from chronic sleep disorder problems. Researchers have uncovered links between poor sleep and health issues ranging from obesity to cardiovascular disease to mental health disorders to death." That's a direct quote from the National Institute of Health Director, Dr. Francis Collins. So don't fall for this, you guys. Get it tested, get treated. We'll get to how to do that here in just a minute. How much sleep is normal? Maybe you don't even know. Maybe you are getting enough. Adults need 8 to 8.5 hours of sleep. Again, this is all from the Mayo Clinic here. But sleep needs obviously vary from patient to patient. So if you're getting 7 hours and 56 minutes, don't panic. And if you need 9, don't panic. But newborns, they need 16 to 18 hours of sleep per day. Preschool children, 11 to 12. School-age children and adolescents need at least 10 hours of sleep at night. And at puberty, kids need between 9 and 10 hours of sleep every night. Most teenagers get how many hours a night? Direct quote from the Mayo Clinic, 7 to 7.5. So we need that sleep, you guys, or what'll happen? There you go. Weight gain. Women who slept less than 6 hours a night or more than 9 hours were more likely to gain 11 pounds compared with women who slept 7 hours a night every night. So even though they were just barely under the normal, weight gain was attributed to that. And why? Because sleep deprivation is believed to affect 2 hormones regulating hunger. One is called ghrelin. Ghrelin makes you feel full. So after your tummy fills up, ghrelin is released to your brain. Your brain goes, "We're full." And leptin, L-A-P-T-I-N. This is the one that when you don't have any food in your belly, it gets released and your brain goes, "Uh-oh, we're hungry." So when you don't get the right amount of sleep, your ghrelin and leptin are affected and you feel hungrier and you want to eat and you don't even know, and you don't have the chemical rolling around to tell you you're full. And hence you'll gain 11 pounds on average per woman. All right. So sleep and snoring. Is snoring normal? Should you snore? Everybody knows somebody who snores, that's for sure. Well, it's loud, and it affects, no matter what, it affects the person sleeping next to somebody who's snoring, of course. But do you know somebody who snores? What does that mean? Think about it. If I'm breathing normal now, you can't hear that. If I tighten that constriction down with my airway, allow my tongue to fall back on my throat a little bit, and then try to breathe, I can snore. So by definition, that is called sleep disordered breathing. You shouldn't have to struggle to get enough air to go through your lungs to oxygenate your blood and keep your brain going. So is sleeping normal? No, it isn't. I mean, if your airway's compromised, your airway's compromised. So what helps with sleep though? Quality matters too. You can't just say, oh, I got 8 hours of sleep, but if you suffocate yourself and you wake up, you don't get to go through those stages of sleep down into the REM sleep where we get some really good repair, digestion, immunity, growth, learning, long-term memory is all down there in that REM. So our brain doesn't do anything until we get down in there, and then it goes, now I can work and store this stuff. Otherwise, I have to keep us from suffocating while we're sleeping. So the quality of sleep matters too. There's all sorts of the stages. There's 1, 2, and 3 in REM, but we really need to get down into that REM stage. There's 6 reasons to get enough sleep. Number 1, learning and memory. You gotta get there. You gotta get that REM. Metabolism and weight. We just talked about leptin and ghrelin. You know, I gotta get enough to keep those 2 chemicals from raging through our body. Safety. Obviously, you're gonna make mistakes when you haven't had enough sleep. You might pull the wrong tooth. Might fall asleep behind the wheel. I know people that have died in their sleep driving around the wheel of a car, and that's not good, you guys. Your mood. Obviously, if you're irritable all the time, you're probably not getting enough sleep. Cardiovascular health. You probably don't even know it, but your arteries are hardening because of the stress on them from not getting enough oxygenation while you're trying to sleep. And disease. What happens when we get enough sleep? We get to fight with our immune system more. It recharges our battery. But these are all common things we all know. So what about taking a sleep diary? What if you don't know what you're sleeping? Well, that's a great idea. Just every day, just journal it. Sleep, I went to bed at 10:22 p.m. When you wake up, write it down. 6:35 p.m. or a.m. I woke up. I felt this way. Noticed I'm groggy. I hit the snooze bar twice. That will help you a lot in determining if you're getting a good quality of night's sleep. That's for sure. So sleep apnea again affects 22 million adults, and they with diagnosed sleep apnea. There's 100 million more without even being diagnosed about it. Common sleep apnea signs for if you're trying to help your friends and loved ones is snoring and gasping or choking sounds, obviously. But there can be such a thing as a silent apnea where you just see their chest rising and falling, but no air is moving. So it's dangerous. It can occur for 30 seconds, from a few seconds to a couple minutes. And that's where you get some really damage. And that's where my cousin Jim probably fell, is right into the couple minutes per night of not getting the oxygen to his blood, to his brain. Discussing sleep issues. Who do you talk to? Dentist? Healthcare provider? Both. Why wouldn't you? It's your body. You got to take care of it, right? It's your vessel. It gets your spirit and your mind from A to B. You need the body. And guess what? It needs more than everything. More than water, food, clothing, shelter. Are those the basic needs? What is the most important thing? Air. You can't go 3 minutes without air. You can go days and weeks with all this other stuff, but you can't go more than 5 minutes without air. So discuss it with your healthcare providers. Here's some questions you can consider. How often do you have trouble sleeping? How long have you had the problem? When do you go to bed? When do you get up on your work days? And when do you get up on your days off? Yeah. How long does it take you to fall asleep? How often do you wake up at night? How long does it take you to get back to sleep? Do you snore loudly? Do you snore often? Do you wake up gasping, feeling out of breath? How refreshed do you feel when you wake up? How tired are you feeling during your day? How often do you doze off or have trouble staying awake during routine tasks, especially driving? Do you experience dry mouth, snoring, sore throat, morning headache, daytime drowsiness, or does someone you love experience all of these conditions? There you go. Here's another. So this is something you can talk to about with your dentist. If you talk to your healthcare provider, they should be able to point you in the direction for getting a sleep test. But if you grind your teeth, it's like the #1 risk factor for knowing that you have sleep apnea is grinding your teeth. It's called bruxism. It causes receding gums. Your roots start showing. They get wiggly, real sensitive. Then you got to get it covered. That's caused from your brain trying to send the message to your mouth. Hey, the airway's blocked. Can you do something? So you grind your teeth in it to try to pop open your airway. So you can take a deep breath. What about gum disease? Does that lead to sleep apnea? Absolutely. Recent studies showed 60% of patients diagnosed with periodontitis, which is gum and bone disease, had obstructive sleep apnea. They go hand in hand. And then periodontal disease is an inflammatory disease, and so it causes inflammation in this area, so you're going to get more swelling, get a lot more constriction. So take care of your gums too. Obviously, floss your arteries. So how do dentists treat sleep apnea? Guess what? We got little things called these little appliances. This is one here. This one's called the My Tab. It's pretty cool. We put a little liner in this bottom, a little liner in the top, stick it in your mouth. When it hardens up, we can adjust this, and check it out. This one's already pre-adjusted for the lower jaw. Be a little bit farther forward than the top jaw. How does that work? If I put it in and I try to make a snoring noise like this, but if I have my jaw forward and open like that, inside, I can't snore. I can't. It's just by definition. You have to close down. You have to let your jaw go back. You have to let your tongue vibrate against your palate. But if you move it forward, it pulls it away. You can hardly do that. So that's how these oral appliances work. That's how we can help you in dentistry to treat sleep apnea. Only for mild to moderate cases, though, because if you're severe, you're going straight to CPAP down. Who wants the octopus thing on their face? Raise your hand. Raise your hand. Yep. Well, here's an appliance that can go in similar, how we use the appliance therapy to help our patients. But anything I want to try to keep you guys off is that darn CPAP. That thing looks like an octopus strapped to your face. Want to see it? There it is. Look at that. Dentist in the CPAP machine? No way, Jose. The dentist helps you not have a CPAP machine. So get tested. That's the number one thing, the take-home message there. So you can choose. You can have your dentist help you, or you can go to your healthcare provider, physician, whatever. They're going to steer you right into a CPAP machine because they don't know about oral appliance therapy, and that's why we're here to help you understand that. But if you don't get help with an oral appliance, please get a CPAP. So we're done, but we're just getting started too, because I want to tell you how to get tested. You talk to me. Call my office, Lifetime Dental Care, 785-625-7969. That number again, 785-625-7969. Go to our website, lifetimedentalcare.com, and call us. Contact us so we can help get you tested. First thing we can do is actually have you going with what's called a pulse oximeter. What's pulse mean? Heart rate, beats, beat, right? An oximeter, oxygen, measure how much oxygen is in your blood. This thing goes on your wrist and over one finger, and you just go to sleep. It's free. We have it here for our patients. Just come get one. We'll let you take it home, and you bring it back. We plug it in the computer, and the computer goes blah, and it tells us how much oxygen is running through your blood all night long and how fast your heart raced. Because if I strangle you for 30 seconds to 40 seconds, what's your heart rate have to do? It has to pump harder and faster. Why? To get that what little blood you have left through the rest of all your arteries and veins to keep this thing going so you don't die. Okay? So that's why we want to get you tested. If you find out your pulse oximeter comes back pretty high, we're going to send you for a sleep test. You can get that done at the hospital. Here in Hayes, we have one at the sleep clinic at the hospital, or we actually have partnered with a at-home sleep test. It's called Home Sleep Test, and homesleeptest.com, I think, is the company, and they will send this big old suitcase to you, and you open it up and you put the same things on your wrist. Something goes around your chest to check inspiration. So there's a cannula that goes over your ears and into your nose, so it catches oxygen and carbon dioxide, and then we get an actual diagnosis from a board-certified sleep pathologist who tells you whether or not you have sleep disorder breathing, apnea, or any snoring, or any variation thereof, and then you and I can sit down and talk about what we can do to help you. Okay, so what was your number one takeaway today? Mine would be that anybody can be a victim of sleep apnea, and if you don't treat it, you're going to get in trouble. So please remember to give me a call so I can help you out. 785-625-7969. Let's fight apnea together. We got brochures, we got models, I got books, I got time. I'll help you. That's my job. I am your healthcare provider. I can help you find an oral appliance so you can sleep like these people do. All right, Dr. Lowe, Lifetime Dental Care. Peace out. Thanks, everybody.